Welcome. So glad that you could all join us today. This webinar is being co-hosted by the Population Council, as well as the Reproductive Health Supplies Coalition. And my name is Sophia Asan, and I'm with the RHSC. We're so glad that you could join us today. This webinar has benefited from being supported and sponsored by Panorama Global, as well as ICFP 2025 in partnership with us at RHSC, exploring the intersection of reproductive health supplies and climate change is a key programmatic area within RHSC's program of action. We are so keen to promote understanding of the challenges and realities, to identify means for adaptation, mitigation, and resilience, and to help bring forward and support helpful collaborations. We recognize that many of our members across the globe care so much about these issues and are involved in efforts in their own countries to make a difference, such as in adaptation or resilience. Please do remain muted throughout this event unless you're speaking to everyone. We'd love for you to introduce yourselves by entering your name, organization, and the country from where you are joining us in the chat box. Also, feel free to enter questions at any time or your comments. While guiding questions have been prepared in advance for our distinguished panel, additional questions will be fit in as time permits. It's now my great pleasure to introduce Ricardo Regules, who will guide this webinar. Ricardo is a geographer with a background in biology and a PhD in population studies. He has worked with the Population Council since 2019, and he's currently a consultant for the Population, Environmental Risks, and Climate Change Initiative, also known as PERCC. His work focuses on demographic and urbanization projections related to climate impacts. In Mexico, he has led research and programs advancing sexual and reproductive health and rights, particularly among adolescents and youth. His recent studies also explore the links between climate and mental health among young people, as well as shifts in fertility preferences during crises. So it's now my great pleasure to hand off to Ricardo.
Thank you so much, Safia, and big thanks as well to Panorama Global, the International Conference of Family Planning, and the Reproductive Health Supply Coalition for co-hosting and co-sponsoring today's session. We're really glad to be working together on this as part of the PERCC initiative at the Council. And as you already know, PERCC stands for Population, Environmental Risk, and the Climate Crisis. And it is a council-wide initiative that looks at how climate and environmental changes drive migration and affect people's health, including sexual and reproductive health. Our goal as an organization is to close key gaps in knowledge, create practical tools and data, and help shape stronger climate policies at every level. It's important to say that we also approach this work through a climate justice lens, recognizing that those most affected are often the ones who've contributed the least to the crisis. So as part of the PERCC initiative, this is the second and final webinar in a two-part series. The first session took place in October, and both sessions were in both sessions we're sharing findings from community-led case studies supported by the Council, as well as from colleagues across the organization. The The sessions explore different aspects of the connections between climate health and sexual and reproductive health and rights. And together, they're meant to be a space for learning and exchange across countries and across colleagues as well. At the PERCC initiative, we see community-based organizations as central to advancing climate justice because they are on the front lines with those most affected, helping ensure that solutions are grounded in real experiences. The two case studies we're sharing today were created and led by local partners, shedding light on voices and experiences that rarely make it into the global discussions. We're also including a presentation from our colleagues on a scoping review examining the links between SRHR and climate in sub-Saharan Africa. And this is an important contribution that hopefully will help to frame these local experiences within a broader regional evidence. Finally, I want to highlight the central role of young people in this research. As you know, they are among those most affected by climate shocks, facing many disruptions, especially in education, health, and of course, when it comes to access to sexual and reproductive health services. So hearing directly from them is essential to shaping more inclusive and sustainable policies for the future. So having said that, today's session features two case studies, one from Tanzania and one from Kenya, along with a scoping review on how climate change and SRH intersect in sub-Saharan Africa. Together, they show how communities are living and responding to health and SRHR impacts of climate change and how gender inequalities shape these experiences. These studies shine a light on the challenges women and adolescents face, as well as the creative community-led solutions already taking place. They also remind us why sexual and reproductive health must be part of climate adaptation and disaster planning, and hopefully they will inspire practical lessons for building more inclusive and climate resilient health systems across countries. So we're very pleased to have three colleagues with us today who will share their work and experiences. Each presenter will have about 8 to 10 minutes. So to our presenters, please keep that in mind. After the three presentations, we'll open the floor for about 15 minutes to Q&A. I will start by posing a couple of questions to the presenters to spark discussion and encourage participation. And then we'll take additional questions from the chat. So please feel free to pose your questions at any time, and we'll do our best to cover as many as possible. After the Q&A, I will hand it over to Kirsten Kruger from ICFP. So our first speaker is Dr. Mary Nicolaus. She's the head of programs at Amplified Health and Development in Africa, HDA. She's a medical doctor specializing in community health and leads youth-led initiatives to strengthen primary care and resilience. Today, she'll share her work on how young people and communities in Tanzania are addressing the health impacts of climate change. Please go ahead, Mary.
Thank you, Ricardo. Hello, everyone. So I'm here to present a case study from Tanzania, Mtama district on climate change. Our study focused on viewing the climate change and health-related impacts and insight from youth and community health workers in Mtama districts of Range region. As we all know that climate change is a global public health threat, increasing the frequency of floods, drought, and heat waves, which fuel outbreaks of vector-borne diseases. In Tanzania, there is an increasing effect of climate-sensitive diseases, such as vector-borne diseases, where according to the Tanzania Health National Adaptation Plan, it's notified areas like vector-borne diseases, nutrition, and water-related illnesses. In Mtama region, there's a wave of recurrent flood disrupting health services damages, which damages infrastructures and worsen food and water insecurity. As we can see on the picture on the right, that is the Mtama Road, which has been destroyed with the recurrent flood. This happened this April this year. And most of the communities here, they are exposed to poverty and they're depending on farming and fishing, which with weak infrastructures that amplify community risk and reduce adaptive capacities. So the research gap that is existing is the limited evidence on how communities, youth, and community health workers understand and respond to the health impacts of climate change at grassroots levels. So the purpose of this study was to examine the climate change awareness, perceived health impacts, and community engagement in Tama district. So on methodology, the population involved community health workers, youth, and community members. While the study design, it was a mixed method with 7 focus group discussions, which involved youth and community health workers to capture their lived experiences, perceptions, and coping strategies. And on quantitative component, we administered a structured questionnaire to 208 participants across selected villages in Tama to collect on knowledge, attitudes, and practices regarding climate and health impact. So can you move to the next result slide? Yeah. So this on the left here, it's social demographic characteristics of the study participants, where most of the median age was 27 years, and most of them were 25 years and below, meaning half of the population were youth. And also, most of them, they had attained primary school and secondary school. And on the awareness and understanding of climate change, 88% of the participants, they were aware of what climate change is. And their main source of information was on educational institutions, followed by medias, radios, community health workers, family and friends, and local government. And there was an understanding of climate change in as changes in weather patterns, where some describe it as the increased season of rains or maybe droughts. Next slide, please. So among the population on quantitative, over 80% of them, they had a perceived link between the climate change and health. And most of the reported health impacts were waterborne diseases, including cholera, typhoid, and diarrhea, and then followed by malnutrition, and then mental health issues such as stress, anxiety, and vector-borne diseases such as malaria and dengue, and respiratory diseases like pneumonia and asthma. Next slide, please. So also, among the population, they notified the role of youth and community health workers in climate and health response, whereas 81% of them, they were aware that youth and community health workers had a role to play in climate health response, and there are 80% who were not sure, and 5 who thought it's not. Next slide, please. On qualitative insights, community health workers, what the major findings were: community health workers play a crucial role in educating communities and raising awareness. One of the quotation was one of the participants who said, as a community health worker, when I receive proper training on climate change and return to my community, I can transform people from not knowing to understanding what we need to know and why. And also, climate change impacts on mental health. Weeks without being able to go to the farm because she lost everything that she had planted a year ago. And also there are visible impacts on, there are visible health impacts on communities, reported the increased malaria and diarrhea cases. And also due to the fact that the rainfall that destroyed the road infrastructures. So there was a cutoff of health services from the Mtama district members to referral hospitals in Lindi. And also in some villages, they confessed that they had, due to the heavy rainfalls that caused the incoming of dangerous animals such as crocodiles into areas where people were farming, which resulted into serious injuries, disabilities, and even death. Even now, some of the people's health were not fully recovered. Next slide, please. Yes, also there were sexual reproductive health related observation from the focus group discussions. And these were grouped according to the groups where from women who were primary participants in household food production, the loss of their crop, it disrupted their work and food security. And one of the implications was stress, poor nutrition, and also due to the destruction of the infrastructures, women were limited to have access to sexual reproductive health rights access. And also there was for the women who are on maternal period, they had a high risk of maternal health risk because of the delay for them to be able to reach on the referral hospitals. And then youth who were involved in farming and household tasks equally affected by crossroads. Most of them, they didn't, because they depend on farming to get to be economically stable and afford education. So there are some of those who lost the chance to continue their education and exposing them to risky behaviors. And also children are also dependent on the household food. So they are vulnerable to malnutrition and stress, which as a result of that cause impaired growth, early health vulnerabilities, and potential long-term of reproductive health effects. So in general, economic and food straits compounds vulnerability and highlights the need for integrated interventions addressing climate resilience, nutrition, and sexual reproductive health. One of the community solutions that we noticed during the study is that some of the farmers, they moved their farms from near the rivers where there used to be flooding to other places. And also they use traditional knowledge to make sure during the planting, like they change the planting instead of they used maybe to plant on December. Now they're changing, looking at when the rainfall will be available. Next slide, please. So the recommendation that we got from this study is that communities need to be empowered to design and run local information hubs using village meetings, calls, and radios to share timely alerts on disease outbreaks. Sexual reproductive health issues, extreme weather, and safe agricultural practices. And also we need an increased financing and technical support to youth because they are primarily the one who are major affected. They face the longer effects of climate change. And the community health workers who play a role on educating the communities need to be in a core programs at community level, such as CSO, CBOs, and the religious group to sustain their impact at community levels. And over 88% of respondents recognize climate change as health risk, but the understanding of indirect pathways also is still limited. So in scaling up, local data can help to bridge the gaps between community perception, scientific evidence, and supportive effective intervention, informed policy planning, as well as on the forming of Tanzania Health National Adaptation Plan for 2024-2020. Thank you.
Thank you, Mary, for the presentation. Our next speaker is Reinhard Nyandire, a Nairobi-based researcher and practitioner working on climate resilience, SRHR, and community-led adaptation. His work looks at how drought and heat stress affect health and SRH services, and how local solutions can keep care accessible for women and adolescents. Today, he'll share findings from his case study, impacts of climate change and community-led adaptation and gender-responsive policies in Kajiado County in Kenya. Reinhard, over to you.
Thank you very much. I hope I'm clear enough. Thank you, Ricardo, and thank you, my former colleague, for the presentation. Now, I'll look at all this from a governance perspective, and especially from what I would call the hard-to-reach communities. So, I have been looking into the aspect of agenda. It went beyond the sexual reproductive health and rights within the region. I also looked into the population dynamics and overly gender, climate change, and health perspective from a governance and a county level. County is more different countries call it federal government or the local government. We used to call it local government. In Kenya, we have the counties. So that's what I was looking at. Kajiado County is predominantly pastoral, heavily pastoral indigenous communities that have been marginalized over quite a number of years. I know the term marginalized it's been debated recently politically. So I've been looking at that in terms of what is the status quo. And then my work has been embedded or falls under, especially when you look at the UNFCCC processes, from the Lima framework to the Gender Action Plan that was luckily enough or thankfully enough passed in the last COP29, COP28 and 29. I've looked at it from a global perspective, a regional perspective, national perspective. Do we really have the enabling conditions to mainstream health and climate change? And also through this, we can also mainstream SRHR in climate change adaptation and mitigation initiatives. And also looking beyond that, because as I mentioned before, these are hard to reach communities. That have been marginalized from different fronts, and the women pay the full cost, I would say, of climate change. So it went beyond looking into the existing strategies. What are the global strategies? What do we have at the moment, and how do we make what we have work? Or if you don't have it, then what do we need to make what we have work? So that's what the work was heavily embedded around. Next slide, kindly. Yeah, so as I mentioned, the main objective, we are not really reintroducing a new wheel. We're using what we already have. So the primary objective is to bridge the climate resilience and gender equity and reproductive health governance systems in the region. And Kajiado County is, what makes it again unique is that it's, as I mentioned, a heavily patriarchal society, or traditionally or historically patriarchal society. So you can imagine that what we're dealing with around not climate finance, sorry, but around sexual reproductive health systems is very, very elusive, emotive, and very sensitive. So again, as I mentioned, the local communities have paid the heavy price of climate change impact at the very local level. But at the same time, there's been some progress in terms of gender mainstreaming at the local level and also the national level and also regional level. However, SRHR still remains marginalized or marginal in climate policy discourse in the region. Next slide, please. So as I mentioned, why this is unique, again, we are dealing with a heavily patriarchal, to date, it's still patriarchal, and you also don't want to impose the modern scientific ways into the traditional governance system. So there's a way in which we really have to figure out how to also talk about SRHR in a way that the local communities can be on board or can get engaged heavily. So based on my previous experiences, some of the areas of weaknesses that we have maybe had is that we target mainly mainstreaming or empowering women, but we leave the men behind. And then in the long run, it becomes counterproductive in a way that now we've experienced increased gender-based violence where we have empowered women. They go home, men view that the women are challenging them, and et cetera, et cetera. It changes with time. It's the way they are, but at least there's some hopes, at least, and opportunities, which I'll maybe highlight later on. So it's so unique that you're dealing with a heavily patriarchal society. It's still indigenous, and that's okay. And also there's a huge knowledge and data gap at the very local level, and also sometimes to some extent at the very national level. At the same time, we're dealing with a community that have been heavily impacted by climate change. So from the impact of climate change to getting the stake in terms of biodiversity laws into another particular society, women pay the full cost of conservation and climate change. Next slide, please. So methodology, we did a lot of intensive key informant interviews, community focus group discussion. We focused more on women and then also men, and then we looked into youth and elders, and also they still have what the Maasai call the live bonds. We had a few conversations with them, and we had a very concrete positive input, but then it took a lot of time to gain their trust, but that's what we used. And then, of course, we did a lot of coding and triangulation with the existing literature reviews. Next, please. So as I jump into this finding, as I mentioned, there's a heavy structural and policy gap at the very county or local level. As I've mentioned, the matters leave alone SRHR, but then climate, gender, and health do not speak to each other. From a departmental perspective, policy perspective, strategy perspective, there's a huge disconnect between these different entities. So there's a lot of siloed approaches at the very local level, and this has been a major challenge that really came across from all the stakeholder engagement processes. And something that I would also like to mention is also the economics of care economy. There's the aspect of women paying the full cost, but the care economy is not being considered in the existing gender, health, or climate change strategies or initiatives at the very local level, which again extrapolates into now the care economy economics. Next, please. Second finding is the impact on climate change and the gap, this institutional and policy gap really heavily more impact women and girls at the very local level. Again, it's a bit edgy, I would say, also sensitive to talk about matters also menstrual health or sexual reproductive health with the local communities, but this opportunity. So it means that there's a huge opportunity or gap in terms of rural communication to make them really understand and become on board. Again, as I've mentioned a number of times, it's the patriarchal norms that we can't really fight, but we really need to figure out how to embed it with our objectives. Next, please. The final one, as I mentioned again, is the weak institutional coordination. There are different departments that do not really speak to each other from, it's not really from, they don't like each other, but there's a huge knowledge gap or data gap. There's no proper existing data to really showcase the impact of climate change on health and vice versa. And there's no proper intensive awareness creation at the very local level within this patriarchal society or traditional or indigenous community around health or sexual, reproductive health and climate change adaptation, and also care economy, which is something that really came up strongly, and I would say a key opportunity for Population Council and other potential partners. Next, please. So as I mentioned, Kenya has a national population health and environment strategy, but then it's not been heavily localized. So there's a huge opportunity. I think this is one of the major recommendations that came up to develop a county level population health and environment strategy or initiative that brings in together all or consolidates all the existing policies at the national level and regional level, and also creates a forum for interministerial or interdepartmental engagement process. And then there's also that need or opportunity for data integration, and leave alone data integration. Aside from that, there's lack of data in terms of the impact of health on climate change and vice versa at the very, very local level. So there's a huge opportunity for that. There's also a huge opportunity to also really recognize community governance. As I mentioned, it's still traditionally a patriarchal society. It would be counterproductive to go there and start pitching, like women must lead and all that. But then we need to also really take into consideration, because there's also some areas where like within the Loita conservation area where women still lead, and they're still heavily involved in governance systems. So how do we take advantage of that and showcase the success story of scenarios such as in Loita Hills and take it to other areas where it's still heavily patriarchal? So there's a lot of opportunity, I would say, or challenges or in mainstreaming gender at the same level, but then also taking into consideration the local traditional governance system. At the same time, there are also existing finance mechanisms on climate, around climate and also biodiversity economy that we could also take advantage of to mainstream SRHR at the very local level. So it revolves mainly around institutional and legal frameworks and also finance at the very local level, especially at a stage where we have financing mechanisms on locally led climate adaptation initiatives. Next slide, please. So based on that, as I mentioned, it clearly came out. There's a huge opportunity for different partners and also Population Council to spearhead the development. This is something that really came up. It goes beyond Kajiado. It also covers the coastal communities in Kenya, where there's a need for development of or localizing the national population health and environment strategy at the very county level. There's a need for capacity building for these different entities, both within government and non-state actors and also the local communities. At the same time, there's also need for intensive and effective impact-driven rural communication initiatives to be rolled out on the same. There's also the need for knowledge co-production, this weak data, or if it is existing, it's not consolidated. And then finally, also to maybe mainstream or champion for inclusive financing or mainstream the SRHR and climate adaptation within the existing climate finance initiatives at the country level, national and regional level. Next. Yeah, as I wonder, climate change is still a major challenge within these communities that I've been working with, and integrating health beyond just SRHR. It's a huge opportunity and a huge challenge, and there's a huge gap from knowledge, data, engagement, strategy, initiative levels. So I would say this is I won't call it a minefield, but it's a gold mine, or I don't know the best term to use, but there's a huge opportunity here for different entities to come on board. And there's also already a willingness for the local communities and the local governance systems to also participate in the same. So there's also a huge challenge which faces Kajiado County and other counties in terms of the systemic fragmentation and the potential, to have this as a model county for different counties in the region. So hopefully we could translate the existing evidence of this report into policy, into instruments, policy brief, and have a long-term engagement strategy towards developing a PERCC strategy or initiative, and then maybe have a clear plan or pathway to address the existing gaps. Thank you so much.
Thank you, Reinhard. So our final speaker is Dr. Jacinta Ramadi, who leads research at the Population Council Kenya on the links between climate change, health, and SRHR. Her work explores how climate impacts intersect with education, gender, and environmental justice to inform evidence-based policies for climate resilience. Today, she'll share findings from her scoping review on interventions at the intersection of climate change and SRHR in sub-Saharan Africa. Jacinta, please go ahead.
Thank you very much, Ricardo, for the introduction. And let me also thank my predecessors for the interesting presentations they've made. Thank you, Mary and Reinhard. I guess Reinhard's presentation really highlights a few of the things that I wanted to talk about today. The study that I want to present here is on the state of climate change and SRHR interventions integration in Sub-Saharan Africa region. This is a scoping review that we did at Population Council Kenya to just inform policy and programming at the intersection of climate change and SRHR. Next slide. So just a little background, Sub-Saharan Africa as a region has two main challenges that it faces. One, that it is one of the regions that is highly vulnerable to impacts of climate change, but it also it has poor SRHR outcomes, including high adolescents pregnancies, as well as gender-based violence issues or issues there. So with these with the poor SRHR outcomes, you find that climate change can come in and dilute or even water down some of these gains that have been made, because the region has made a lot of gains when it comes to improving SRHR conditions, more so when it comes to reducing child mortality as well as maternal mortality, or aspects of reduction of HIV infection rates there has been strides in these, but you find that climate change might impact these negatively. However, when you look at climate actions, both mitigation and adaptation actions, these have the capacity to bring in what we always refer to as health co-benefits for SRHR, which can really help improve SRHR situations. But as well, you find that SRHR interventions also have the capacity to increase resilience to climate change impacts. So the two is to bring in and increase community vulnerable people's resilience to climate change and improving SRHR condition. So this study was meant to really look into the interface between the two, the integration of interventions at the intersection, and that was the key in order to identify gaps and even enablers for future integration or intervention integration. Next slide. So some of the key findings have been highlighted in Reinhardt's presentation. I will just mention but a few. Climate change and SRHR integration is still at a very early stage. Not much has been done in the area. The scoping review found very limited or very little evidence that shows integration. And of the limited evidence that we generated or we found out, we find that of the several SRHR elements, maternal newborn and health, newborn health, as well as HIV were the key elements that had some of the integrated intervention. Other intervention addressed multiple elements, SRHR elements, including maternal newborn health and family planning, or maternal newborn health and HIV in combination, which were very good. But other SRHR elements remained adversely unaddressed and lacking evidence around them, including gender-based violence issues, as well as FGM issues and child marriages. Sorry about that. So you find that these were the main ones that really had interventions around them, but quite a number of them remained adversely, unaddressed. But the main reason as to why they were unaddressed could be due to the fact that climate change is not put on the table when it comes to these issues. Interventions that addressed the intersectionality between SRHR and climate change actually addressed impact pathways like agriculture, food security, livelihood improvement, and income generation activities. And neither did they look into SRHR issues directly. So the outcome of these interventions had a direct positive outcomes for SRHR. And the other thing that this study found out is that climate change or climate hazards were implicitly mentioned. They were not the core issues that were being addressed. It's the causal channels or the impact pathways that these interventions were looking into, and SRHR came in secondarily. So I think in future, there's need now to have climate change or look into climate change hazards or issues directly, put climate change on the table, address its impacts and how they relate to SRHR, so that interventions can be tailored to the specific SRHR and climate impacts or the negative impacts that climate change poses. Next slide. So other findings include interventions that included social protection in form of conditional and unconditional cash transfers. And these ones resulted in positive SRHR outcomes for pregnant women, lactating women, as well as children under 5. Where families are given cash transfers and they are made unconditional, you find that families have the room to invest in livelihood improvements also, and in issues such as generation of resources or money that they can use, or even in boosting family businesses. So that was able to improve, therefore, SRHR outcomes for the target group that I've already mentioned. The other finding is that integrated approaches, such as those that included agriculture, food security, or even nutrition, with SRHR interventions such as SRHR messaging, especially those that target the male participants or male members of the community, included with family planning, and even community mobilizations. These worked well in enhancing community adaptive capacity as well as household adaptive capacity. But at the same time, they increased SRHR outcomes for pregnant and young adolescent mothers aged between 15 and 24. These ones were the beneficiary groups. Again, you find that most of these interventions never looked into what we call the vulnerable groups, including the indigenous communities or even persons with disability, or those that live in fragile settings. Still, a lot of evidence is needed, or there's not much evidence at the moment that addresses these key groups. Yet these are the groups that are worst affected by the impacts of climate change. Next. So some of the barriers have been mentioned by Reinhard, a lot of them. He has talked about the siloed approach to interventions implementation. This one was found as the key factor that inhibited interventions integration. And I think historically, these sectors have always conducted their interventions, their programming in isolation. So coming together is still a challenge. And I think this has been reinforced by the weak interdisciplinary or cross-sector collaborations that assist there. So I think it's the history that now makes these barriers a challenge that needs to be broken. So a new record or new tools and mechanisms need to be brought on board, because at the moment, since there's a siloed approach to intervention integration, therefore find that there is inadequacy in methods, in approaches or tools that can be used in integrated interventions programming. So that's something that also appeared in this study. And of course, I mentioned earlier on, there's not a clear focus on climate change. Most of these interventions that are implemented do not really focus on climate change impacts and how they relate to SRHR outcomes. That connect or that relationship is lacking or is missing. And therefore, a lot is missed in terms of how these interventions are designed and even implemented in order to achieve an outcome. Funding has also been mentioned. It is a bit of an issue because you find that most donors have their priority areas, and these priority areas at times do not intersect. And therefore, these also result into disaggregation of these two key areas that could, in a way, synergize and bring in resilience to communities. Policy-wise, again, there is lack of policy integration, like has been mentioned in the previous presentation, in government development plans and even in action plans that are in existence. Most countries do not even mention SRHR in their national adaptation plans or any other long-term, growth development strategies, or even in NDCs, they are not there. So because this is not captured at the policy level, therefore we find that it's lost somewhere in the process. Next. We identified a few enablers or facilitators to integration, and some of these capacity building of community of practice. And some of these things are already being practiced or being done by some of the institutions, especially the African group of negotiators and experts, does capacity building. When this and more is conducted, then we'll have lots of skilled persons that could be able or that can be able to conduct interventions implementation or even implementation studies for that matter. The other enabler is a need for increased multidisciplinary, or what I would rather say, there should be a deliberate multidisciplinary response that integrate climate actions with SRHR information and services. For instance, there is need for deliberate integration of agriculture with SRHR or with health, water and sanitation with health, or even energy. Energy has a lot of, as a sector, has a lot of potential for health co-benefits when it comes to mitigation, but still that's not coming out in the interventions that are currently being implemented. Probably that may happen in future. And another enabler is integration. When policy is modified and implemented, then these will be able to provide opportunities for SRH to be included in climate change actions, in disaster risk reduction, and even early warning systems to enhance the integration. And then more implementation studies are needed to divulge what works or what does not, and how to scale up what's working. So more studies are needed in that area. And lastly, increased advocacy and campaigns on climate justice and environmental justice. This one can be done, and I think it's missing more at the local or sub-regional level. A lot of campaigns are happening at the global stage. If this could be brought at the local and the subnational level, then more action would be seen spurred within the national jurisdictions. Next. In conclusions, still, SRHR and climate change interventions integration is at a very low state. And however, you find that this study found a couple of studies that were still ongoing, some projects that were still ongoing and running, and therefore they were excluded from this research. Therefore, we hope that moving forward and in future, there'll be more recognition and integration of these two areas. And of course, there's need for increased funding of the integrated approaches, especially population health and environment that Reinhard has elaborated on, and One Health. These two approaches, if embraced, then they'll be able to support integration. And lastly, the need for co-creation. Co-creation is a key issue, especially within of these multidisciplinary approaches are needed. When these are done, then a lot will be able to help and address the challenges, the SRHR challenges, at the same time using the same instrument and same resources to tackle climate change impacts. Thank you. Next slide.
Thank you, Jacinta, and thank you to our presenters for those thoughtful reflections, and to everyone who shared questions and comments. Given that we are running out of time and we are very mindful of everyone's time, we will skip the Q&A section. However, we are aware that there are a few questions in the chat, and we will share these with the presenters who will reply via email. Also, we will share with you the presentations via email in a few days. So now I'm pleased to hand it over to Kirsten Kruger, co-chair of the ICFP Environmental and Climate Change Subcommittee. So go ahead, Kirsten.
Hi, everyone. Thank you, Ricardo. Can you hear me and see slides?
Yes.
Wonderful. Thank you. Well, I'm very pleased to represent the International Conference for Family Planning 2025, which is occurring in Bogota, Colombia in just about 3 weeks. For just a little bit of background, in case folks are less familiar with ICFP, this is the world's largest scientific meeting for family planning, contraception, sexual reproductive health. It started in 2009 and is supported by the Gates Institute with many different partners. And this is the first time the conference has been held in a Latin American country. So we're very excited to be in Colombia. The theme for this year's conference is Equity Through Action, Advancing Sexual and Reproductive Health for All. And this is the first time, while climate and environment topics have been on the program schedule for some years, this is the first time the conference has had a dedicated track for environment and climate change. And I am one of the co-chairs that's been working on the track and related auxiliary activities. So I'm very pleased to work with my colleagues and trailblazers. I can see some of them on the slide there. And as a sort of some structure around how we operate, we're very excited that this year's conference drew almost 5 times as many submissions as the 2022 conference. So we can really see a trend in increased attention, awareness, and findings and interventions that can be shared with our community. We also have some sessions that are will be held in French and Spanish. The track is organized around some work streams, so pre-conference, and this webinar is an example of some of that work. There's a pre-conference event, there's during the conference, and then there's post-conference. And I'll drop some links in the chat, but there's a very big environment and climate change listserv that the conference has supported, and that listserv is still active, and you can join it if you'd like. A few more details about some of the events and activities related to the ECC track. We've got a pre-conference that we're putting together in collaboration with the Humanitarian and Crisis Settings Subcommittee. That's happening on the Sunday before the conference officially begins. Also, before the conference officially begins, there is a ECC related session that is part of the Youth Summit. We have, during the conference, a side event with, well, actually two side events, a breakfast and then an evening event, a high-level donor and policymaker roundtable, and then a side event looking at policies and frameworks. There are lunch and learn roundtables during the conference in 3 languages, and then a post-conference event that happens on the Friday after the official conference, which will help distill some of our takeaways, lessons, recommendations, and help bridge some of the messages we'd like to take to COP30, which happens the following week in Brazil. This is just a highlight of another webinar that happened last month, and there are the recording is available. I'll drop that in the link. And then I just quickly wanted to highlight the next Drumbeat webinar that's happening next Thursday. And we're just very grateful to be included with all of these partners, and special thanks to Pop Council, PERCC, RHSC, Panorama Global for making it so easy to highlight this topic and generate more interest and build our community. So let me drop some links, and please do reach out to me if you're going to be at ICFP in Bogota, and we can figure out how to connect and plug you in if you're interested. Hope to see you there. Thanks.
Thank you, Kristen, and thanks as well, the Reproductive Health Supplies Coalition, Panorama Global, and ICFP for co-hosting and co-sponsoring today's session. We are on time, so I'll just close by once again thanking our presenters and everyone who joined us today. And we will be sharing with you questions and responses via email, as well as slides and recording and other materials. Thank you very much, and have a good day, good afternoon, good evening, wherever you are. Thank you.